personally have struggled with my weight my whole life. And it wasn't until I got turned on to some of these concepts that I actually was able to lose the weight and keep it off over time. Now, quite a number of years. The whole concept of not going on a diet, but changing your lifestyle to something that leads us closer to health is certainly what worked for me, and it's what I've seen work for patients at Parkview as well. So the concept of protein, it's essential, we need it, but too much isn't good for us, and going on a high protein diet could actually put us in harm's way as it relates to our kidneys.
Yes.
And not only that, with the high protein diets, those are usually the ones with the high fat. So as we all know, fat can contribute to heart disease. So you've got that other risk factor there. Fat can contribute to cancers, particularly colon cancer. So the studies aren't really out there to show the long-term effects of the high protein diet on risk for cancer, heart disease. I know back when Dr. Adkins was so popular, many, 5-8 years ago, that he was trying to fight that would cause colon cancer. But it would be very interesting to see what the studies show if that diet was followed for the long term. I don't think there's too many people that I've seen can follow a high protein diet, low carbohydrate diet for the long term. And like you said, most people can keep their weight off with a high carbohydrate, low fat diet, maybe because it's a little bit more palatable and there's a little bit more variety in that.
And what you mean by high carbohydrate diet, cookies are high carbohydrate. Does that mean I can eat cookies and lose weight?
But cookies are also very high fat.
Right.
And then, unfortunately, when we talk about carbohydrates, there are ones that are better for you and ones that aren't better for you. And when you're looking at cookies, although they do have some complex carbohydrates, the majority of the calories in cookies are from fat and sugar. And sugar is that refined carbohydrate, and if you're wanting to lose weight, that's not the one you want to eat. You want to avoid those refined carbohydrates, eat less of them rather than more. I remember a cookie recipe in my grandmother's cookbook, and it said 1 cup of fat, 1 cup of sugar, 1 cup of molasses, and I think it was 2 cups of flour. Well, you know where the calories were coming from, and they were good cookies, but they weren't good for you necessarily.
So what you're talking about is complex carbohydrates, fruits, vegetables, legumes, whole grains, that sort of thing.
Right.
Okay, you just burst my bubble. Thanks a lot. So tell me a little bit about, well, I think we've established that diets, probably anyone can lose weight on a diet. What we want to move towards is a lifestyle that lends us more closely to health and that will help to not only lose the weight, but keep it off in the long term as opposed to the short term.
Right. So it needs to be something that's realistic for that individual. I don't prescribe any one particular diet for everybody. I mean, that wouldn't make sense. It needs to fit into someone's lifestyle. So it needs to be realistic and something that someone can live with. It's not a diet. It's not going to start and stop. It needs to be something that's for the long term, for their overall health, not just to fit into that wedding dress.
Okay.
Or that swimsuit.
Tell me about the role the glycemic index plays in nutrition as a whole, and then maybe even as it relates to weight loss.
Glycemic index is an interesting concept. Basically, what we're trying to arrive at is how fast does the sugar get out of the food you're eating and into your blood. And we give pure glucose a number arbitrarily of 100. Because if you take glucose and put it in your mouth, it starts going into your blood right from your mouth before it even gets to the stomach. So it would be our 100. If you look at a low glycemic food, it would be a food that takes longer to get the glucose into your bloodstream. A few examples may help you understand it. If you take white bread, like French bread, it has a glycemic index of about 90 to 95. White rice, thoroughly cooked, has a glycemic index of about 95. Brown rice, on the other hand, the glycemic index is much lower, 40 to 60, depending on the type of brown rice it is and how thoroughly it's cooked. Now, I'm not going to tell you not to cook your food, but I will say the more you cook it, the higher the glycemic index goes because you're breaking down that starch. So we want to eat foods that are, number one, natural, because they'll have, by and large, lower glycemic index. For instance, orange juice has a much higher glycemic index than an orange does. So we're better off to eat that orange because the sugar is absorbed more slowly into our system. If it's absorbed more slowly into the system, we don't get that feeling of a letdown mid-morning. If you had coffee and a donut for breakfast, you get that fat, and that won't let you down, but the sugar will, and the caffeine actually allows you to absorb the sugar more rapidly. So mid-morning, you get that letdown. Whereas if you had old-fashioned oatmeal and some raisins and some fruit in a bowl, you wouldn't get that mid-morning letdown. And even though you consume the same amount of calories in both of them, you'd actually eat less calories with the whole grain and fresh fruit because you wouldn't have that hunger sensation mid-morning. And that would help you lose weight, and it would improve your nutrition, and your nutrient value would be much higher in a more in an unrefined diet than in the refined.
Is this partially related to fiber?
It sure is. Most of the low glycemic index foods are the ones that are higher in fiber. If you think about a sweet potato, it's amazing to me sometimes when I speak with anybody with diabetes, they're like, I can have a sweet potato. They're amazed because, you think sweet, I can't have that. A sweet potato has much more fiber in it than a white potato, and it has a much lower glycemic index than a white potato. So anything with more fiber usually has a lot lower glycemic index.
Interesting. I lived in China for a couple of years, and they have these wonderful baked sweet potatoes right out on the street, and now I know I made a healthy choice. This is good. So how much fiber do we need?
Most people need roughly 30 to 35 grams a day. Of course, getting more is okay. If you go from eating 5 grams to 35 grams in one day, of course, you'll have some GI distress, so you don't want to do that. But gradually increasing your intake of fiber over the course of the week can definitely be one way to go about doing it.